Hi guys, Johnny Wilson here in association with Ben Dinnery and Premier Injuries. Going to chat a little bit about the speculation that's going on around Roger Mendy. So what I hear on or see on Twitter and on social media is that Roger Mendy has a possible metatarsal injury. So firstly, for those of you who don't know what metatarsals are, I've got the foot bone here. So this is the outside of the foot here, and this is the inside of the foot. So you've got your great toe, your big toe here, and then you see these long bones that come down here. You've got your first metatarsal all the way outside to your fifth metatarsal, and this guy here, this is the guy that's most commonly injured. And there, if you're looking at the anatomy of it, you've got what's called the base. If I turn it like this, you've got the base up here, and then you've got the shaft, and then you've got distal end, and you've got 3 types of fractures and 4 types of injuries that can happen here. So you've got a base fracture, so sometimes that can avulse off, which we'll talk a little bit about. A Jones fracture, which can happen around the base area, just around here, and then we can have a stress fracture at the middle of it, of the bone, and also we can get some bony bruising. They can be very painful injuries to the fifth met. There can be a lot of swelling, a lot of bruising. It's very hard for players to get their feet into the boot, and very hard to make space in the boot as well. So sometimes as a physio in professional football, we would try and make donuts, so a little bit of a ring around the area so to shake off the pressure, but that doesn't really work because the boots are so tight these days. So how do you injure them? Well, there's a few ways you can injure them. Usually what happens is that guys will have an inciting event. They'll have a mechanism of injury, so they'll sprain their ankle. So what happens when you sprain your ankle is that you've got muscles and tendons which come down and they attach to the base of that, so that of the fifth met. And as you go and turn your ankle, as you laterally sprain your ankle, what these can do is the lateral band of your plantar fascia, this here, and then these peroneus tendons here, what they can do is they could end up pulling the bone from literally breaking it off. Secondly, you could have, it could be a kick, so with some bony bruising, and thirdly, it can be as a result of an overuse injury. Due to the high stresses and the forces that occur with moving the foot when we're running, jumping, turning, twisting, kicking, etc. So the likelihood is Roger Mendy will have had a full assessment from the sports medicine teams that he works with, whether that's internationally or with his club. So these guys are very experienced and very good at what they do. In football, the likelihood is that he will have had some type of imaging, whether that's an X-ray or an MRI or an MRA, which is more sensitive to bony injuries. He'll have had some type of imaging anyway, and that's the expectation of professional football. As part of his assessment as well, they'll have done some palpation around this area, and they'll be looking for pinpoint tenderness. The reason why they'll look for that is they want to differentiate it from an ankle sprain here, an isolated ankle sprain. The types of fractures that you can get around here, one is the avulsion one, which we've talked about, so that can tear the literally avulse, cut off the end of the bone here. You can have a Jones fracture here, which is a lateral fracture here, so and then you can have a stress fracture due to just it comes on with overuse. The way these are managed is a little bit differently. The avulsed fracture, so that heals quite well and can heal within 4 to 6 weeks and doesn't usually need surgery. The Jones fracture, because of where it isn't great to heal, or are stress fractures. That's due to poor blood supply and a lot of high forces and bending and torsioning around this bone here, and it's not very big either. So what usually happens is that they have surgery, and then a screw is put down the shaft of the bone here to pull the 2 ends of the bone together. Now players, there have been some reports that some guys have got back within 8 weeks, some guys have got back within 6 months. Usually guys get back within 8 to 12 weeks. So if it is likely to be bony bruising, what you don't want it is to propagate into a worse injury. So you don't want it to propagate into a stress fracture or an avulsion fracture or a Jones fracture. So they'll certainly have to treat this with absolute respect and to see how it goes, which they would do, because they're they're all good guys. Strategies for to speed up bone bruise or bony injuries. So if you look at the research, they talk about high dosage of vitamin D or some ultrasound bone stimulators that they use as well. And with regards to rehab, usually it starts with off-feet conditioning, moving on to partial weight bearing, and then on to full weight bearing on the pitch, looking at running and high impact. So with the off-feet stuff, we're talking about carrying out aerobic and anaerobic fitness sessions on the watt bike maybe, and in the pool, doing some pool running there, and moving on from there. So, in summary, it's because of where it is and the high forces and stresses and pressures that are put on the foot, and the bending of the bone and the fragile nature of the bone, it can be a tricky one to manage. There's high levels of pain associated with this and high levels of dysfunction, and I wouldn't kind of get too carried away with kind of going, oh, it's just a bony, it's only just bruising, because bone bruising can be quite sore, very difficult for players to get their boots on, and it certainly can lead to a significant time loss injury, and has got a high probability of recurrence, so high re-injury rates, and especially if it's a Jones fracture or a stress fracture due to the poor blood supply and the high forces going there. Listen guys, I hope this video has helped you out. I hope it's shed some light on injuries to the fifth Met and some time frames. Please feel free to comment below. Please like and subscribe. And if you've got any questions, just give us a shout. Give me or Ben a shout, and we'll be happy to add to this short summary. Okay, take care guys, from myself and Ben at Premier Injuries. Bye now.